Guys, Dr. Ingram here with Flourish Dental Boutique. So cone beam CT or CBCT is a type of three-dimensional X-ray that is becoming more and more common in dentistry. It provides vastly more diagnostic information than we've ever had before, tailored to viewing the details of the mouth and the head. It does not replace traditional X-rays, however. So here's a summary of the capabilities of both types of imaging. And as you'll see here, 2D X-rays are really still the best at detecting cavities that can't be seen with the eyes yet, and detecting the depth of cavities. CBCT is really not capable of doing that very well just yet. But CBCT does have areas where it really excels and goes above and beyond what a two-dimensional X-ray can show, like issues in sinuses, things like cavitations, looking at wisdom teeth, all kinds of things that provide a lot of diagnostic value. And with radiation, the continued improvements in imaging, allowing X-ray machines to use less and less radiation, the safety profile of this type of imaging becomes more and more favorable. So to put your radiation exposure into perspective, here you can see some common radiation sources from least to greatest. And as you'll see here, even something as simple as eating a banana can provide you with a tiny little bit of radiation. The sun provides radiation. So anytime you go higher in the atmosphere where the air is thinner, then you'll get more radiation from the sun. So you can see that cone beam CT from a dental cone beam CT provides less radiation than a flight from New York to LA. Also worth noting that some of your more intense medical imaging, like for instance, a medical CT, provides significantly more radiation than any of the dental types of imaging systems out there. Now, some of the benefits of CBCT are, for one, is screening for oral and systemic issues. So a CBCT can detect issues in the sinus that may impact oral health. We can measure airway volume, so we can see if you're breathing through, I like to tell patients, we want to see if you're breathing through a PVC pipe or a coffee straw, with the PVC pipe being much more optimal than the coffee straw. We're looking at growth discrepancies in children because we can see the width of the jaws as they're developing. We can see how far apart the teeth are, where those permanent teeth are developing in relation to the baby teeth. And we can also screen for possible pathologies in the jaw bones and teeth that just can't be seen with a 2D X-ray, even the panoramic X-rays. Another huge benefit is not just screening, but actual diagnostics. A cone beam CT is just far superior at seeing infections around root canals or the roots of teeth. A lot of times we'll back up what we're seeing on a 2D X-ray and can see it much more clearly on a CBCT, and sometimes they don't show up on the 2D X-rays at all, where they do show up on a 3D. So we can also detect what some people refer to as cavitations, which are really just non-healed extraction sites, areas where the bone has not healed correctly after a tooth has been removed. This happens frequently in wisdom teeth sites. And so we're able to see that and actually measure the bone density of an area, which is incredibly valuable. The pathologies, like we talked about sooner, not only are we able to see any cysts or tumors or growths in the jawbone, But now we can see these in 3D. So we know if it's something that's aggressive and it's taking away existing bone structure, or if it's expanding what should be normal bone structure around it. Fractured teeth is something that is incredibly difficult to see on a 2D x-ray. It's only the fractures that are at a very specific angle, just basically perpendicular to the angle of the x-ray, are able to be seen on a 2D x-ray. Whereas a fracture on a cone beam CT is much more easy to see because you can manipulate that image in all different directions. We can also detect root canal treatments that might be incomplete. We have a lot of patients that are worried about their root canals for one reason or another. And so we can see in 3D and in great detail where anytime a root canal is either ideal or if it is not ideal. And of course, we use the CBCT as a guide for certain dental procedures. For instance, in implant placement, the surgeons will often do a CBCT first to plan exactly the direction that the implant is going to go to make sure the angle is correct in all dimensions. Before a root canal, if a patient is going to have a root canal done, then many times they will take a CBCT to determine, are there things going on in the tooth that would make a root canal not possible, and would make it less likely to succeed. And then they can look ahead of time and see, are there any canals that might be difficult to spot or might be hiding? For wisdom teeth, also incredibly valuable, especially on adults who need wisdom teeth removed that have had time for the roots of those teeth to get longer than, say, in our young teenagers. We want to see where those wisdom teeth are in relation to the very large mandibular nerve. We want to know if they're touching the nerve, if they're close to it, so that we can see what is the likelihood for any nerve damage if a procedure is done here. So again, the CBCT provides us some really valuable information, so much so that I really encourage it for every single one of my new patients. It's something that we use every day, multiple times a day, and for multiple reasons. So I hope that helps give you some more details and help you see the value in it. And we'll see you next time. Thanks.